Okay, hello everyone. Today is my assignment for 705 to Dr. Shihana. My name is Yasmin Usama Kader and my roll number is 1350187. So my topic is Miconazole. Miconazole is sold under the brand name Monistate, among others. It's an antifungal medication used to treat ringworm and other yeast infection of the skin or vagina. It's used for ringworm of the body, groin, and feet, especially feet for like athletics foot because they exercise and do sport. It is applied to the skin as a cream or an ointment. Miconazole is mainly used extremely for the treatment of ringworm, including jock itch and athletic foot. Internal application is used for oral or vaginal thrust, like for example, yeast infection. This oral gel may be also used for the lips disorder, angular, and other associated systems. Okay, interaction. The substance is partly absorbed in the intestinal tract when used orally, as with the oral gel, and possibly when used vaginally. This can lead to increase in concentration of the drug that are metabolized by the liver enzymes CYP3A4 and CYP2C9. Because meconazole inhibit these enzymes, such interaction occur. For example, anticoagulants of warfarin type, some newer A-type antipsychotic, and most statins used to treat hypercholesterolemia. These interactions are not relevant for meconazole that applies to the skin, like the medication for the skin. Okay, mechanism of action. Meconazole inhibit the fungal enzyme 14 alpha steroid demethylase, resulting in reduced production of ergosterol. In addition to its antifungal action, meconazole, similarly to ketoconazole, is known to act as antagonist of the glucocorticoid receptor. Pharmacokinetics. After application to the skin, meconazole can be measured in the skin for up to 4 days, but less than 1% is absorbed in the bloodstream. When applied to the oral mucosa, for example, like possibly for the vaginal user, is significantly absorbed. In the bloodstream, 82.2% are bound to the plasma protein and 10.6% to blood cell. The substance is partly metabolized by the liver enzyme CYP3A4 and mainly eliminated by the feces. Side effect, like itchiness or irritation of the area, which was the ointment or cream applied to it. Use in pregnancy is believed to be safe for the baby. Miconazole is in the imidazole family of medication. It works by decreasing the ability of fungi to make ergosterol, an important part of their cell membrane. Okay, there are many routes of administration. There is oral to treat like oral and intestinal candidiasis. Uh, Dermal to treat fungal infection of the skin and nails, like for the skin mostly. Eyes, like solution, like they're not cream but solution for the eye, and meconazole have been used as for topical application to the eye. Parenteral route, like by IV infusion in the term of severe systemic fungal infection. Others, like meconazole nitrate, is available like in the different formulation for treatment of vaginal candidiasis, like an intravenous solution has been used for like the bladder, trachea, and wounds. Rational use. Meconazole is antifungal agent with similar antimicrobial activity to ketoconazole. It is administered by intravenous infusion in the term of severe systemic fungal infection, including candidiasis and infection due to pseudodylisteria, boydite. Miconazole may be given by mouth for treatment of oral intestinal candidiasis. It has been prophylactic to patients at high risk of opportunistic fungal infection. In fungal meningitis, intravenous treatment may be supplemented with intrathecal infection of miconazole. Miconazole nitrate is used orally. Irrational uses. Miconazole should not be used in patients known to be hypersensitive to this drug. Since miconazole are absorbed in small amount from the human, miconazole should not be used in the first trimester of pregnancy unless the physician considered it essential to the welfare of the patient. Brand names, there are many brand names, like for the oral treatment, Dactrain, like, and the oral gel, the 24 mg 20 mg, or give 50 mg. There is also external skin treatment, Ziasorb, the topical cream like 2 to 5%, and there are other combinations for miconazole cream. Okay, I have a case study. A 51-year-old man was admitted for treatment of recurrent severe hemoptysis associated with pulmonary aspergillosis. He was in chronic respiratory failure. He was a non-smoker. Biochemical indices of liver function were normal. There was a past history of asthma and also epilepsy for 20 years, for which he was receiving phenytoin capsules 300 mg daily. The epilepsy was well controlled and the dose of fentanyl had remained unchanged for 5 years. During this time, he had complained of intermittent dizziness and unsteadiness, but the plasma phenol concentration had not been estimated. He began treatment with intravenous miconazole 500 mg every 8 hours and oral flucytosine 2G every 6 hours. The phenytoin dosage and formulation remained unchanged. The next day, he complained of nausea, vomiting, and blurred vision. He was treated with metoclopramide. 3 days later, his symptoms were more severe and pronounced nystagmus was noted. These symptoms and signs were attributed to the miconazole, and the dose was decreased to 400 mg every 8 hours. However, his symptoms was persisted. Okay, our case study. We're gonna use the sub. First, the subject. His age was 51-year-old, gender male, history. He had a history of like coughing blood, but though he was not a smoker. And there was a past of asthma, like a history of asthma, and also epilepsy that lasted for 20 years, for which he was receiving phenytoin capsule 300 mg daily. There are symptoms like dizziness, unsteadiness, chest pain, coughing, and coughing up blood, like he was coughing blood, and shortness of breathing. Our objective, after physical examination of the patient condition, he was given miconazole intravenously, 500 mg every 8 hours, and oral flucytosine 2G every 6 hours for 1 week. Symptoms of nausea and vomiting and blurred vision can be shown. These symptoms can be controlled with the decrease of miconazole, like to decrease the symptoms of nausea, vomiting, and blurred vision. We will only decrease miconazole to 400 mg every 8 hours. Assessment, sample of blood which had been collected and stored for other purposes were analyzed. Nausea, vomiting, and blurred vision can be treated with metoclopramide if they appeared on patient. Some side effects may be shown from miconazole like burning, stinging, swelling, irritation, redness, and pimple-like bumps. Plan. Miconazole in vitro is a potent inhibitor of hepatic cytochrome P450 enzyme, which are responsible for phenytoin metabolism. The only drug interaction with miconazole in vivo of which are aware is potentiation of the effect of warfarin. However, patients receiving parenteral miconazole concurrently with phenytoin or other drugs that metabolize in the liver should be closely observed. Okay, and thank you for what if.